Thank you for joining the expert session on exploring weight management and weight-related behaviors for individuals living with spina bifida. The content addressed today is in response to questions asked during last week's Ask the Expert session on the same topic, as well as questions you submitted when you registered for this session. My name is Judy Thibodeau. I'm a member of SBA staff. I'm joined by my colleagues, Juanita Panliner, SBA's Resource Manager, and Jessica Palmieri, SBA's National Director of Marketing and Communications. I want to mention a few things before we get started. You will remain muted throughout the session. This is because we want to allow the experts to respond to all of the questions submitted in advance of this session. You're welcome to submit any new questions to the panel of experts using the Q&A feature on Zoom. If time allows, the experts will answer any new questions tonight. Everyone who registered for this event will receive a link to the recording. Closed captioning is enabled. If you have any technical issues, please send a text to Juanita Panliner at 202-487-3988. This session is being recorded. Now I'm pleased to introduce today's experts. Theresa Crytzer. Dr. Theresa Crytzer is from Duquesne University in Pittsburgh, Pennsylvania. Dr. Michele Polfuss from the University of Wisconsin-Milwaukee. Dr. Jen Tudor from St. Joseph's University in Philadelphia, Pennsylvania. And Joanne Whelan. Dr. Joanne Whelan is from the Indiana University, Indianapolis. At this time, I'd like to turn the program over to Dr. Jen Tudor.
Hi, everyone. Thank you so much to SBA for allowing us to be here today again to answer some questions. In thinking about the questions that were submitted in the past few weeks, one of the things I noticed is that a lot of personal questions were asked about a particular situation. And I wanted to take a few moments and provide a couple of principles, I would say, that comes from my own personal experience being an adult with spina bifida and trying to understand weight management and my own behaviors that contribute to it. So there'll be a little bit of sharing from me, and just if you have any questions, I'm happy to answer them. So please feel free to put it in the Q&A. The first thing I want to say is there is no one size fits all. There's a lot of great general principles that Dr. Whelan, Dr. Crytzer, and Dr. Polfuss is going to share with you. And the one size doesn't always work for me. And so, for example, in my life, what worked for me in high school in terms of my eating patterns and habits and my exercise patterns and habits do no longer work for me in that quite in the same way because my life has changed, my experience has changed, and my physical health has changed. So for example, in high school, I graduated at a tight 90 pounds. I'm about 4 feet, 10 inches. If you kind of stretch me out, I'm about 4 feet and 10 inches. I use a wheelchair full time. And I did not experience the freshman 15. I experienced the freshman 40 because the amount of my physical activity went down significantly. And I didn't even realize how much physical activity I was doing as a high schooler and how little I was doing it as a college student. So for example, in high school, I was playing wheelchair basketball twice a week, doing long distance wheelchair racing. You wouldn't believe some of the kind of like, so for example, I grew up in a split level home. So I was crawling up and down stairs for most of my high school life. And that burned calories that I didn't even realize I was burning. So whatever I was eating, I go to college, I'm eating the same kind of meals. I didn't really change my meals, but all of a sudden, because my physical activity changed, my weight changed. And so the difference of when I was 90 pounds to when I was at heaviest, it was almost like 55, 60 pounds heavier. However, you know, my life situation changed again when I went off to graduate school, and my diet changed again because I was cooking more instead of eating in the dorms and things of that nature. And so I was able to bring down my weight. And again, it was a slow process, but my lifestyle is one of those things where what worked for me at one point in time didn't necessarily work for me at another point in time. So it's constantly something that you want to be editing and monitoring. The other thing I wanted to say, aside from one size doesn't fit all, and it can change with time, is that small changes can make a very, very large impact. And so even one thing of like, cutting out maybe a particular sweet or not, or adding maybe one change. So Dr. Crytzer, when she was talking about exercise regimen, make one change a week as opposed to trying to do a whole bunch of different things at the same time. It can make a huge impact in your overall health and wellness. Finally, I would want to end with this idea of knowing the right thing is not the same as doing the right thing. And so I can say this, I am considered an expert in sleep and metabolism. So I know exactly how missing out on sleep is going to affect my metabolism. So it looks like I'm an aged person. That did not change or affect me in terms of how I slept until my husband was like, no, we must go to sleep at an appropriate time and wake up at an appropriate time. And so he helped me normalize my sleep patterns. So in the same way, I would say, sometimes we are looking for specific information, hoping to hear the right thing, or hoping to hear the thing we want to hear. But again, what I would say is sometimes small changes make a big impact. And whatever you hear and take away from Dr. Whelan, Dr. Crytzer, and Dr. Polfuss today, I encourage you just a little bit of change over time and keep monitoring how things go. Like I said, I was 90 pounds. I ballooned up to about 148, if I remember, at my heaviest. I'm now down to 115. But going down to 148 to 115 took time and effort. And there were little changes that I made over time that really made a big impact. And so, for example, now I do experience some chronic neuropathy. And so, for example, I can't push a wheelchair the way I used to. So I don't do long distance racing anymore because of some of the neuropathy in my legs and tendonitis in my shoulders and things of that nature. So I had to change my physical activity. So, for example, I swim a lot more now than I did before. And one thing I will say is that it's incredibly rewarding when you're able to make one small change and continue with it. And I encourage you to do that because then that's only going to further your journey in this process. So I wanted to wish everyone good luck, and I am going to turn it over to our next speaker. Thank you.
Thank you, Dr. Tudor. We appreciate your insights and sharing that information with all of us. I will go ahead and read through the nutrition questions that were submitted in the last session. And the first question there is there a recommended daily calorie intake for people with spina bifida who use a wheelchair and don't stand throughout the day? For able-bodied persons, we've heard it's 2,000 per day. And that's an excellent question. And you're right, we do hear often in our US dietary guidelines, our food label, a lot of those, the general calories for adults is a rough estimate around 2,000 calories per day. And then that helps give us guidelines on how much of each and every other nutrient we want to have and what percentage of that nutrient based on those guidelines. However, daily calorie intake is something that it is very individual, and we want to take into account a person's age, the gender, current height, current weight, and also factor in activity level so we can get the best idea of what that individual might need for their energy intake. Some ways to think about that or how to calculate that would definitely be to talk to your provider. The MyPlate website has the My Plan available for you to be able to enter in your own personal information to help give you what some of those guidelines might be. And that reference will be listed for you again at the end of this presentation. Typically, we want to make sure that we're getting in adequate amounts of calories, and sometimes we hear that the more of a minimum for most individuals can be around 1,200 calories in a day, and that might be to just do basic functions. So maybe that's breathing or digestion or kind of where we are at resting energy. But to have something that's more specific for each individual would again take into account those factors that we mentioned, getting in or accounting for your age and gender, current height, weight, and activity levels. The next question is, how can a dietitian help someone with spina bifida who has weight issues? So dietitians are often available through your clinics, perhaps. Some may or may not have a dietitian on site. And if you don't, you are welcome to ask your provider to connect you with someone to get some of these guidelines in place for you. But as a dietitian that works in this area, what we typically do, we'll talk to the individual and talk to the provider and see what the guidelines or recommendations might be for the individual, but also take into account what an individual with spina bifida, what your goals are as far as weight, and as well as what the eating pattern and goals for there are. We definitely want to take into consideration what your preferences are, any cultural aspects to that, foods that are typically in the diet already. So we would listen to what a 24-hour intake might typically be. And then we'll work with you to help come up with some suggestions for things to include. So we're meeting all of your guidelines in addition to that, but we're getting in all of your vitamins and minerals that you need in a day. And we're going to specifically emphasize getting in adequate fiber as well. So those are some places where we would start. We would then look at some ways that we can help cut down a little bit in some areas and maybe then give you an idea for a substitution. So for example, if you're having a sandwich, maybe we would give you an idea to how to make some changes to get in more whole grains. And then over time, if there's room for changes that could be made in the diet, then we would help try to reduce total energy intake. So by the end of the week, have a goal then of 1 to 2 pounds weight loss, which would be more of a slow progression toward achieving that goal, whatever that might be based on the individual. The next question is, what are types of foods that people with spina bifida should eat, considering challenges with weight management? So the first thing I would say there is taking into account that we want to make sure that we're getting a variety from all food groups. So that's general recommendations for the healthy population. So getting an adequate fruits, vegetables, whole grains, lean proteins, making sure that we have foods from the dairy group or supplemented there to get those nutrients as well. But some specific highlights I would make would be to make sure that we're getting an adequate fiber and making sure that your fluid calculations are adequate to help with any bowel protocol or bowel regimen that is there. So I would definitely highlight those parts of the diet to make sure that would be included and emphasized. And then again, looking at it more from an individual standpoint to figure out what substitutions could potentially be made or additions to help with weight management overall. The next question is, I have an addiction to soda. Is there a type of soda that is less harmful to drink? And I'm going to assume here that maybe the individual is referring to regular sodas, so sodas that have regular sugar added. And so taking that into account, regular sodas will have a lot of added sugar. And so our dietary guidelines recommend that we limit our sugar to no more than about 10% of our daily energy needs. And so if we do think about it in terms of the 2,000 calorie diet for adults, that rough estimate, 10% of that would be no more than 200 calories. So if we thought about it in terms of a 12-ounce soda, that's roughly 150 calories. It depends potentially on which type of soda. But that is pretty close to where that 10% of extra sugar is. So if you're having a regular soda and other added sugar foods, then we're probably going over that guideline. So an alternative to that could potentially then be switching to a calorie-free soda. That could be something there too. Some other ideas would be to think about seltzer waters or flavored water in general. If some individuals prefer to have more of that bubbly type carbonation, maybe a club soda, but then add in some limes or lemons, or think about other ways to still add flavor. Ideally, we want to have adequate calorie-free water hydration and getting in milk or adequate amounts of the dairy there, that would help be that other supplement to any other fluids that we might need. And that's just for nutrient sake, getting in our calcium and vitamin D. Just one example there too, and I wanted to kind of tie this question in and maybe expand on it just a little bit too. If we are adding in a little bit more soda, so for example, more than one. So if we go up to maybe 3 sodas in a day, that could already be at around 450 calories. So even just by taking that out of the diet might even be a way to help with that 1 pound of weight loss per week. So just to give you another example, I was not exactly sure with how much soda would be consumed there, but just to give you some other tips. The final question there is, my doctor says my body's B12 is low due to my having a MACE and suggested I take supplements. What foods are high in B12 and can I get enough from foods? And this is really something I think we should all really kind of tune into, especially as we age, because vitamin B12 plays a significant role in our red blood cell formation and our DNA synthesis. And the red blood cells will help carry oxygen throughout our blood. And if we don't get enough in, or our body's not absorbing it, we might end up feeling drowsy or just kind of low energy levels. So it is important to get vitamin B12 in and to get it in daily, because it's a B vitamin, so it's also a water-soluble vitamin. So you do have to replenish that daily. B12 can be found mostly and pretty much only in animal products. So we get concerned if there is a very limited or vegan diet where maybe no animal products are included. So B12 can be found in eggs, dairy products, fish, and then any chicken, beef, or other animal meat related items. So it is definitely important to get in. And then I would say if you're having trouble getting in adequate amounts, if you have a blood test and can kind of tell if you're low in that level, that's probably the most accurate way to know if your diet is giving you enough, and also if you're absorbing it. And if not, that might be the time when you talk to your provider about adding in a supplement of B12. And then again, that would I would suggest monitoring that regularly and over time to figure out what would work best for you. I thank you for those questions, and now I'm going to turn it over to the next speaker.
Okay. So thank you, Dr. Whalen. One of the questions that we have is that many women with spina bifida struggle with body image. Have you seen a connection between weight, body image, and the prevalence of eating disorders in women with spina bifida? And is it different among men with spina bifida? So this is a really interesting question, and it's really topical, because when you think about our society, we are very fixated on weight or bodies. And a negative body image can really lead to a person fixating on their own body and then start to try to make changes through changing their food intake and subsequently sometimes dieting. Dieting can mean a lot of different things, but in our culture, it's oftentimes omitting food groups or looking for a fast weight loss. And that can sometimes go to extreme and then lead to disordered eating patterns. So not everyone that diets will have a eating disorder, but there is a link as far as some disordered eating happening. As far as the difference of women and men, both have a risk of having eating disorders, and it is not always thought of commonly, but men do get eating disorders just like women do. And I was unable to find any specific evidence specific to spina bifida. So great question. The next question is talking about, and I think the next two questions kind of go together. So one question, does having a short stature, as is the case with many men and women with have spina bifida, contribute to being overweight or to appearing overweight? And then also the next question was, is it possible to say how much weight is too much based on your height and the extent of wheelchair use? For example, what weight is too much for an adult man or woman with spina bifida who is just under 4 feet tall? So those are both very similar questions as far as concepts that they're getting to. And what I would say is it's hard to answer specific to anyone, and it's always recommended that you talk to your healthcare provider. But what I would like to expand on is the fact that height does play a role as far as when we think about how much weight we should be carrying or the ideal body weight for us. So if you want to think about that, it's not that a shorter stature will cause overweight, but it does give you less to work with as far as a height to weight ratio. The best way that we do this is you typically look at a body mass index, and that's what's telling us our categorization of where our weight is. So are we at a healthy weight? Are we carrying excess weight? Are we considered overweight or obese? If you remember from our last talk, we're giving a little premise here. A body mass index is a calculation that is based on height and weight. The unfortunate part of it is we know it's not perfect. We know it's only a proxy to give an idea of someone's body fat. And it also is pertaining to it was developed based on typically developing. So there's a lot of reasons why it's not the perfect fit for someone that has spina bifida. But as we talked about last time, it is very useful in monitoring and to monitor for trends and to start conversations with your healthcare provider. So there are benefits to a BMI. That being said, that is why the cdc.gov website is there. If you wanted to look to see if your weight was considered healthy for your height, you can calculate your own body mass index by inputting your height and weight on this website. If you search body mass index, and it's really helpful, and it does give you some different tips on how to monitor it. And then again, how to have that conversation with your healthcare provider. I think if you can go one step further beyond a BMI, which is only going to give you an estimate or proxy of body fat, in the perfect world, we really want to know what is the percentage of our body fat on our body. So even someone that might be considered a normal or healthy weight could have excess body fat. And the best way that we would ever do that is by a body composition analysis, which is not something that's typically done in a clinical environment, but knowing how much body fat we carry and also where the body fat is located on the body. We do know that body fat that's located in our abdominal region is much higher risk for having secondary comorbidities like diabetes or heart disease. So sometimes you want to trick yourself and just look by the mirror, but you should always take into account and talk to your provider to see if they can give you more information or tell you where a body composition analysis could be done in your area. Okay. The next one here. So how can you tell if you've gained weight or if it's water retention? So this is another interesting and really good question. If you think about it, water is a very significant portion of our body weight. In adults, it can be up to 60% of your body weight. For kids, it can be up to 65%. So that being said, a change in water can really drastically change what you see on the scale. And you might see fluctuations. And if you've ever stepped on a scale one day and then the next day you've gained 2 pounds or lost 2 pounds, it's probably not that you've lost or gained 2 pounds of body fat. It is more likely that you have adjusted your water weight. And so quick fluctuations in weight is one way to tell that it is water weight versus fat. Retention of water or water weight. Why does that happen? There's many different reasons. And so you might notice it more during hot weather or humid weather. So weather can be an issue. Hormones, premenstrual syndrome, those times can be when we retain water. Certain medications can help you lose water or retain water. If you think about a diuretic, it's going to help you expel water from your body. If your body is dehydrated, that can actually cause you to retain water because your body knows that it needs water. So it's always good not to skimp on your water thinking that you're going to lose water weight. It's always good to drink your full amount of water. Your diet, thinking about sodium, retains water. So if you ate a really salty meal or went out to a restaurant which might have more sodium, sometimes you retain water. The next day you might see that fluctuation on the scale. And then medical conditions can also be a cause of water retention. So heart disease, lymphedema, pregnancy, liver disease, kidney disease, all of these can be a concern. So when you see that excess weight on your body and you're questioning, is it possibly water weight? One thing that you might see your doctor or a healthcare provider do is they might press on it to see if their indentation, when they press, if it remains, or if your skin goes right back to where it was. If that indentation when pressing stays, it is most likely excess water weight. And that is edema or pitting edema. There are some times that you should be very cautious. So if you see a huge fluctuation in weight very quickly, or if it's continuing, that is another reason to talk to your healthcare provider. If you see a localized site area of swelling, especially if it has redness or warmth or pain associated with it, that's another potential risk for infection or cellulitis, and that would be a reason to talk to a healthcare provider. And then thinking about lymphedema as a cause of excess water weight or buildup of fluid in your soft tissues. So that is another area that you want to be concerned about. And then similar to identifying the percent of body fat like we talked about, you want to make sure that you can identify if those fluctuations are occurring because of water or fat. So talking to your provider. And I would want to actually ask Dr. Crytzer, do you have anything else to add here? Because I know that your area has worked with this a lot.
Yes, the one thing I wanted to add, you had mentioned lymphedema, and there's about 10%, based on a research article, there's about 10% of people with spina bifida who have lymphedema, and it's something that you'd want to see your physiatrist, your PM&R physician about. And lymphedema can affect the upper extremities and the lower extremities. For example, some women who have had breast cancer surgery, they have swelling in that arm. And so there are physical therapists that actually specialize in lymphedema management. And the lymphedema physical therapists do what we call lymphatic drainage. It's a very special type of sort of light massage that helps to drain that lymphatic fluid back into your lymph nodes, which are, in your armpits, more in your groin, and they're sort of all over your body. And it helps to reduce the swelling. And they also teach people who have lymphedema to do wraps on their legs or their arms, wherever they have the lymphedema, to reduce that edema. And they may be involved as well in ordering stockings or a pump to reduce edema. So that would be where you would talk to your PM&R physician, your physiatrist, and potentially work with a physical therapist who does work with people who have lymphedema and who has that certification. So if that comes about, then that's where that's the place that you would go first, is your physician.
Thank you.
Welcome.
Okay. So the next question, how can I escape my lifelong pattern of gaining and losing weight? So this is an assumption that this is maybe someone that's a little bit further along in age. And I think that we all can relate to this. It's often referred to as yo-yo dieting, or as this person mentions, just gaining and losing the same weight over and over. That oftentimes stems from when we first talked about changing eating for dieting purposes in our culture, where we do a lot of fad diets, we omit food groups. Those are usually things that you will see weight gain or weight loss. And if you see weight loss happening from it, it's very exciting. You think that it's good, but it's really hard to sustain changes that are not incorporating all 4 food groups or making very drastic changes to your life. And if you do that, what usually happens is that you will lose weight, but then you'll gain the weight back. Your body does have a set point, and it's interesting because fat cells can actually, they're going to stick around. They just sometimes get smaller or larger, but they're very easy to come back on once they've been there. So the prevention is best. Consistency of habits is really important, and consistency of how you eat and your activity is going to really help to reduce that yo-yo dieting or pattern of losing and gaining weight. The one thing I will say before asking if anyone else has anything to add, this is going to only get harder as you get older, because as Dr. Whalen already mentioned, as we age, our bodies change. And so there's going to be a loss of muscle mass, and muscle mass is actually very protective and helps us have more energy expenditure during the day and helps us or allows us to eat a little bit more and burn calories better. So as we get older, hormone changes, loss of muscle mass can contribute to not being able to eat like we used to, kind of what Dr. Tudor was mentioning also. So those are my suggestions, is really trying to avoid fad diets, looking for consistency and things that are sustainable to continue on. And I'll ask the panel if there's anyone else that wants to add anything to that. Okay. Okay. So then the last question on this slide, how can I help my daughter who uses a wheelchair from becoming overweight? So this one, this is actually a topic near and dear to many of our hearts in this area. So there's so many things, and I just want to go over some of them. And of course, the panel can add other thoughts too. But first of all, thinking about this as young as possible, the recommendations are, even as we are thinking about becoming pregnant, we should talk about our own ability to be healthy and eat healthy and be active. And then once you're pregnant, continuing those behaviors, because it already transfers in utero somewhat to your child. But as your child is born, we want to start very early on. We want to make sure we introduce all 4 food groups. We want to make sure that their diets initiate because kids are watching us. So you want to make sure also that you're role modeling and that you yourself are taking care of your own body through healthy weight and activity, because even when you're not thinking about it, they're monitoring you and they will learn from you. So I think ingraining healthy habits related to food and activity, not just for you and not just for your child, but for the entire family, is really critical. Promoting all food groups to be ate, not ever calling a food group bad. Also eating for health, not for weight. That's something that we can start early on. I think when we were talking before about negative food body images, the stigma that can be related to weight is something that's really hard to get by, especially in our culture. So just trying to promote that what we eat is really for our health. It's not to look a certain way. Also, setting up your environment. This can be so helpful as far as if you think about it, if your environment is set up for success. So is you're in a kitchen full of healthy food options. So when there is time that you want a snack, are you more likely to pick out the snack option that's a little bit healthier? Or if you have a lot of choices that maybe are higher sugar content or processed foods, is that going to be the easier one to grab? So how you set up your environment can make a difference. How you set up your daily environment. Do you park further away from the grocery store when you walk in, or do you try to get the closest stall? Little things like that are something that can make a difference, as Dr. Tudor mentioned, those little changes, and they also can transfer down to your child. Limiting the empty calories, processed foods, high sugar foods, things like that. Watching portion sizes. Our society has really done very large portion sizes. If you go to a restaurant, you oftentimes are getting a portion that might be for 2 versus 1. So splitting your plate and taking some home. Even children's portions, as you know, are getting larger and larger. So monitoring that, and then encouraging and supporting physical activity and supporting minimizing sedentary activity or screen time. In our world, we think technology is amazing. And so the more technical things we have and advancements, it seems like the more sedentary we get or less active we get. So you want to take some time away from screens, which can be TVs, computers, phones, and then being active as a family. And then I'm going to ask Dr. Crytzer to maybe add to this, but I know that you want to prevent injury and promote activity through basic things like the wheelchair. And I'm not an expert in this area, and Dr. Crytzer is. So do you want to add anything?
Sure. Thanks, Dr. Polfuss. I would add that, you want to make sure that the wheelchair is positioned, the person is positioned properly in the wheelchair, that the wheelchair has a good fit to it. So if a person has gained weight and the wheelchair doesn't fit properly, then they should be reevaluated, and you don't have to wait. Typically insurance will cover for adults a new wheelchair every 5 years, for children every 3 years. But if there's been a loss of weight or a gain of weight, you really want to go back to your physical or occupational therapist who wrote the letter of medical necessity for that chair, and the physiatrist is typically involved, as well as the wheelchair supplier. And so I would go back, make another appointment, and go back for a reevaluation to see if maybe potentially modifications to the seating system or just a differently sized wheelchair is needed. And you can make that decision as a team in that medical team that you have. And the fit of the wheelchair is important because if you have a wheelchair, for example, that's too wide, the problem with that is that you know, it has to fit you properly. But if the wheelchair is wider than it needs to be, let me say that, then your arms and your shoulders are positioned out a lot further than they need to be. And when your arms and shoulders are out further than they need to be, then when you're propelling your wheelchair, you're at risk for developing impingement in your shoulder joints, which means that, you know, there is soft tissue that goes underneath some of the bones that are up here in our upper, you know, neck and shoulder, and they get compressed. And so that can lead to pain and neuropathy and numbness and things like that. And so having a properly fitting wheelchair is very important, both for manual chairs as well as for power chairs. So I would say if the chair doesn't seem to fit right, there's actually a really nice guide on United Spinal's website called My Wheelchair Guide, and it will help. It's you can download it as an app, but it can actually help you kind of assess the wheelchair and see, you know, before you make the appointment, where do you think the issues are? And then it gives you a sort of tracking that you can track who you saw when you saw the person, and helps you to get through the wheelchair service delivery process. And also, the therapist should be also teaching wheelchair skills training to anybody who's using a wheelchair, either manual or power chair.
Okay.
And Juanita, thank you for posting that.
Okay, anything else?
That's all. Thank you.
Okay. Okay, let's move on. So medications and weight management. How can someone with spina bifida and chronic pain lose weight when they've taken medications such as tamoxifen that could cause weight gain and or fluid retention? You know, this can be a lot. You could fill in the blank besides tamoxifen with other medications also. I think the two important things here are there's an external medication or extra medication being taken, and there's possibly chronic pain. So I would take away the issue about what the specifics are and look at what is the underlying reason for that medication. So something like tamoxifen, it's typically being given related to breast cancer treatment. So when you think of breast cancer treatment, there's oftentimes going to be hormonal changes. There will be fluid shifts or lymphedema. There could be even mental health changes or depression. So all of those things can actually affect our ability to have healthy habits and to lose or gain weight. So looking at the underlying cause and how are you taking care of your mental health and physical health is really critical. Just as Dr. Crytzer was mentioning with our last example, if you have chronic pain, it actually can inhibit you from wanting to be active because if something's hurting. So in that situation, it was a shoulder, but in this situation, it could be an ankle or something else. So trying to either take care of pain early or minimize or reduce potential for injury, so you don't have pain ongoing. And then also, if you are on a medication, sometimes there's no other option, but it never hurts to talk to your provider. If you know the medication is related to weight gain, you can always say, is there an alternative? Because I don't want to risk gaining weight with this. In this situation with tamoxifen, it is not known directly to have a weight gain associated to it, but it might be the secondary things that we talked about earlier. Also then considering as you're taking these medications, what are the dietary changes and proactive activities that you can do when you have pain, like swimming versus maybe walking or wheeling? If you can't wheel, using the swimming, I think it's a really great way for low injury and low pain on your joints. The next question, what guidance can you provide to persons with spina bifida struggling with weight management and about taking weight loss injections. So that is the rage, and we are hearing a lot of questions related to this, and we did cover it in detail with our last talk. So I don't want to spend too much time because we have a lot more questions to go tonight. So I would say, please look at our last talk or review that. But in short, our guidance is to always have an in-depth conversation with your physician or healthcare provider, because many of these medications may not be appropriate for everyone, and they will have consequences or side effects that might not be appropriate for you to take them. So it's a very individual choice, and it's not something that we can speak about as a generalization, but you want to be definitely aware of the side effects and if that is something that would work for your body, and if a provider can follow you through it and recommend it. Weight-related research. Is there research related to obesity and weight management in people with spina bifida? And how can someone with spina bifida get involved in research? So these are two examples. Clinicaltrials.gov and dietaryguidelines.gov. Get involved. Those are two websites that we would recommend going to. If you go to clinicaltrials.gov, you can actually put in spina bifida, and it will show you from a national perspective all clinical trials that are related to spina bifida. Some of them might already be done or in the process, but some of them will be recruiting for new participants. And so that is one way. A third way that's not listed, but important, through your organizations like Spina Bifida Association. Oftentimes we'll share through social media or on their website, maybe research that is available. Never be afraid to attempt to find out more and listen and see if it's a good fit for you, and always realize that you can say no. Next question. Physical activity, Dr. Crytzer.
Thanks, Dr. Polfuss. So next we're going to answer some questions about physical activity. And the first question is, what exercises are good for women with spina bifida to lose upper body weight? And I just wanted to go back to something I mentioned, I think last week with another question, is that spot reduction or trying to reduce one area of the body is more of a myth. What's really recommended though is to, three things I'll give you is, one, to pair your exercise with your healthy diet for weight management, as Joanne was mentioning, and then you want to exercise, and this should include strength training and aerobics or cardio workout. And so let's talk a little bit more about specifically, since this person asked about upper body, let's talk about some upper body strength training. Strength training is great. It builds lean muscle mass, which is a more metabolically active tissue. So building muscle is good. I don't know, I think some women may be concerned that if they lift weights, they're going to get giant muscles, like, like an Olympic weightlifter. But, you and I, when we lift weights, we're building muscle fiber and it can tone up the upper body. So this is good. We're not necessarily going to blow up into a Olympic bodybuilder, but we are going to build that tone in our muscles and that strength, which can also do a number of things. That can help us with wheelchair transfers, wheelchair propulsion. If you're using crutches, it can help with using your crutches when you walk. And it also muscle aids in increasing that energy expenditure, as Dr. Polfuss says, as well as in weight loss maintenance over time. And so the physical activity guidelines for all Americans recommend that everybody, including people with spina bifida, would do strength training twice a week. And that strength training can be done using a variety of methods. You can use like dumbbells or barbells, kettlebells, which is a weight with a handle on it. You can also do body weight strength training or use resistance bands. And you can look on any, just Google search latex-free resistance bands because of the high risk of latex allergies. So I'm going to talk a little bit about, if you are a manual wheelchair user, then what we know happens is that because of propulsion, wheelchair propulsion, and how we use our arms, your back muscles tend to become overstretched and weaker, while the muscles in the front of your body tend to become tighter. They're stronger, but they tend to become tighter because you're using that forward motion to propel. That puts you at risk for shoulder injury. So one of the a possible weight strength training program would address this concern of having tight muscles in the front of our body and weaker and overstretched muscles on the back of our body. So I'll give you a few examples of some exercises that could be helpful in this case for upper body. So external rotation is one of the exercises, and that's really protective of rotator cuff injury. So there's a picture on the left there that shows the woman is holding TheraBand, and she's holding it close to her body. Her palms are facing up, and she's pulling that band up. Or pulling that band apart. Now, when she does this, you want to set your body like you want to sit up nice and tall, roll your shoulders back, make sure your neck is in line with your shoulders before you do any exercises. And usually we tell people as you're expanding out, you're going to be breathing in. And then when you allow that band to come in slowly, you're going to be breathing out. So these exercises, it's very important to do them nice and slow. If you want to count, you could count outwards like 1, 2, 3, 4, 5, and then let that come back in slowly. And that helps. And when you're doing that exercise, for example, you're going to squeeze your shoulder blades together as you pull that band out. So that's a really nice exercise to strengthen the muscles around the back of the posterior or the back of the shoulders and the muscles that are in between the shoulder blades. It also helps you sit up taller. The other one that I show here in the middle, it's from a YouTube video. This woman, although she's doing this standing, it's not a sitting position. She moves very slowly and explains these different exercises in a good manner, and she's easy to follow. So she has one of her arms up and behind her back, and the other arm is reaching behind to hold the TheraBand, and she's working on her tricep, which is the muscle underneath your arm, and she's extending her arm up. So that tricep muscle is a muscle that we use when that muscle you use for transfers, when you're pushing up to do transfers. So that's a really nice activity to do. And there's other ways. So, like Dr. Tudor mentioned, not one size is going to fit all. So you may see some of these exercise videos and think, I can't do that certain activity, but there might be a way to adapt it. You can either adapt it yourself or get advice from a physical therapist, because that's what we do. We can help you to adapt exercises. So if you can't bring your arm up to do that tricep press, there's another way to do it where you're holding the TheraBand in the front and extending your arm back. It's a simple adaptation. And then the other thing is the one on the far right, the person is doing more of a diagonal, and that works the back muscles as well. And so the idea is that we're strengthening those muscles in the back of your body. And this isn't all of the exercise, it's not comprehensive, it's some of them. But then we want to do stretch. Can you switch to the next slide? Thank you. So the gentleman, this is called Adapt to Perform. He has some nice videos. I've screened them. And he has tetraplegia, so his upper and lower body is involved. He has a spinal cord injury. But he does a good job of showing and demonstrating. So what he's doing is he has his arm on a wall, and he's stretching out his anterior or the muscles in front of his on his chest, and he'll move his arm up. Now, like for example, you might watch that and say, I can't bring my arm up because I have pain in my shoulder. Well, you can keep your arm there and you can rotate a little away from it, but you're still stretching with your shoulder in a good position. So that's just some examples of the idea is that we want to strengthen the muscles on the back and stretch the muscles in the front of the body. And not that you're not strengthening the muscles on the front of the body too, but we want to work on those muscle imbalances that occur with constant wheelchair propulsion. So the other thing, to go back to the question, and the original question was, exercise is good for women to lose upper body weight. And again, we can't really do spot reduction is a myth, but including those strengthening exercises, but also including aerobic exercise for overall body conditioning is what is recommended by the physical activity guidelines for all Americans. And so remember, for aerobic activity, we want to include exercise that gets us moving at a moderate intensity. And how do we measure that? We tend to use a rating of perceived exertion scale, such as the board or the wheel scale, or we can also use the talk test. And so that's how you monitor your intensity. So, if you broke that 150 minutes down a week, like Dr. Tudor said, it might just be making a small change. That's going to be 150 minutes a week broken up. That's 25 minutes of movement, 6 out of the 7 days, or 30 minutes of movement, 5 out of the 7 days. But you don't have to do all those minutes in one time. So I'm going to give you an example of how you could break it up and make little tiny changes. So say, for example, after breakfast, you might just wheel around your house for 10 minutes, either inside or outside, if you have a patio or a pathway, or you can get into your community. Maybe you just take a 10-minute wheel, get outside, and then maybe after lunch, you find a good aerobic video. You can find aerobic videos on the National Center for Health, Physical Activity, and Disability website. Maybe you do a 10-minute exercise video then. And then after dinner, maybe while you're watching TV, you either wheel around, or you're doing some, boxing or some other form of upper body aerobic activity that gets your heart rate up. So you've just done little tiny bits throughout the day to get yourself moving. And that is increasing your energy expenditure. It's increasing your cardiopulmonary fitness, and also building muscle. So there's just an example on the right of the same gentleman who did the stretch. He's doing an upper body workout without no equipment is needed. So that's something that you can try at home. And again, you have to really, you have to adapt it for your needs. So if, for example, this gentleman's using a manual chair, if you're using a power chair, you may still be able to do some of the motions he's doing. But what I recommend with any video that you're watching, you almost have to screen it and watch it ahead of time and see what are the movements I can do. If you try them and they need adapted, then again, meet with your physical therapist and have them help you to adapt the things that need to be adapted. So, people in power chairs still have upper body motion, so they'll be able to use their body, but they might not have the full range of motion to do the exercise with that full range of motion. But there's still things that are they'll be able to work within the movement that they have. And then the other question, so you can go to the next slide. Many adults have little or no movement in our feet and ankles and have weak hip and leg muscles. We can't exercise those muscles because we don't have control over them. How can we get enough exercise? And this is a good question. So remember that spina bifida, there's various forms of spina bifida. So some people may be using a power chair, some people may be in a manual chair, some people may be using loft chair and crutches with KAFOs to walk, or AFOs. So there's all different levels of spina bifida. And so this particular person who asked this is saying they have no movement in their feet, but they have weak hip and leg muscles. So you can still work the muscles in and around where you have that innervation and have that movement. So even if you have a small amount of movement, you can capitalize on that. So for example, if you want to work your hip muscles, if you do have some innervation in your hips and maybe your upper legs, in other words, they're weak, but you still can move them some, you could do some either leg lifts, or you can move your leg to the side. So say if you're laying down you can slide your leg out to the side using the muscles on the side of the hip. If you have a little bit more strength, you can lay on your side and then you're lifting that top leg up. The key is for any of these exercises that you do with your legs, you want to make sure that your upper body and your back and your legs are in good alignment. And that's something, again, that you would want to work with a physical therapist with to show you what is the best alignment, and they can help you to figure out the best exercise that's going to target those muscles and address that weakness that you have either in like the side of your legs and around the hips. Sometimes too, like say, for example, if you have some innervation into your quadricep muscle, that's the muscle that's your upper thigh muscles. And you could do legless where you're lifting that leg up either from a laying or sitting position, or if you don't have movement, like, so even if you lift that leg up even a centimeter or an inch, you're still getting movement. If you aren't able to lift it, but you can, if you or somebody else can put their hand on your muscle and feel if there's a contraction, that means there's still some activity going on in that muscle. So you might just be working on contracting that muscle. That's called isometric exercises. So there's various ways to do it. It's all going to depend on where you have the innervation, what muscles have that innervation, and some movement that you can work with the physical therapist to do some targeted exercises, and especially strength training exercises, which are great because those can help with your gait and your transfers. Some of the other muscles you might be doing is if you're laying on your stomach, you may be lifting your leg using your buttocks and your hamstrings. And again, that leg may only get a little bit off the ground, but if it's still moving, it's getting some active movement and you're still strengthening that muscle. And while you're doing these leg motions, you're also strengthening your core without even realizing it. And so, and again, always you want to, so that talked more about strength training, but you want to also incorporate, aerobic activity into your routine. And then the next question, somebody asked, how can a person exercise with chronic pain? So if they have a chronic ankle pain. So for this question, there could be various reasons for chronic pain. And, that could be arthritis from, walking without braces, or walking with an ankle that's not aligned. And so you may develop arthritis over time. There could be a lot of reasons. So I absolutely would recommend first checking with the PM&R physician and the orthopedic and find out why the chronic pain is happening. Are there some conservative measures that can be taken? Like, so, for example, PM&R physicians can do injections that can help with reduced pain and such. I'm not recommending those, but I'm saying that you want to talk to your physician, and I'm saying that that's one of the conservative options to manage pain. And but with that being said, if you still want to exercise, you want to do some exercise that's not going to put a lot of weight on that ankle. So things like Dr. Polfuss mentioned swimming, Dr. Tudor also mentioned swimming. That's an exercise that doesn't impact the joints as much if you have chronic pain in your ankle or in other joints. And so then let's go to the next slide, because I know we're running low on time. Try to wrap this up shortly here. Are there any apps that show exercises for wheelchair users, or some exercises better than others? So in terms of apps, there's, I just came across one, and I'll ask for that to be posted. A couple of women with spinal cord injury developed an app more recently, but you still have to be careful, because I was screening it, and some of the videos, they're starting out with a 15-pound weight. And if you're not at that point, you don't want to start out with a 15-pound weight. So again, I recommended any apps or any exercise that you see online, screen it have your physical therapist screen it and find things that work out really well for you, that you're doing that are safe. Also, I highly recommend the National Center for Health, Physical Activity, and Disability. They have aerobic exercises, strengthening exercises. But even with those, you want to make sure if that video is going too fast, which I noticed on some of them, the speed was fast. So if you're new to strength training, I would do like every other repetition or every third repetition, but do that repetition slowly. That's what's important. That slow, controlled motion is very important when you're strength training. With respect to some exercises better than others, I will mention that there are going to be some people with spina bifida who may have tethered cord, or they may have hip precautions where they can't flex their hip past 90 degrees, or they can't rotate if they have tethered cords. So you want to get those guidelines from your PM&R physician and ask if there's any limitations to you doing those exercises. And also some people who have shoulder problems from wheelchair propulsion over the years, as we age, they have to watch over head movement. So if there's an exercise that's having you, push up over your head, well, you bring it down. You don't have to go as high with that exercise. So again, there's those adaptations that has to be personalized and tailored to you. And then lastly, you can go to you're on the last slide, sorry. What are adaptive physical activity resources for people in rural communities? Those of us in rural communities don't have access to adaptive recreation resources, sidewalks, or accessible gyms. I'm going to give some recommendations here. This is a very good question. So I would say start just by breaking up your sedentary behavior during the day if you're at home. So, I talked about the example of doing 10 minutes 3 times a day, but you could even break this down further into every hour for 2 minutes. You're going to move around, either wheeling or doing some kind of physical activity. Maybe it's just, taking out the trash. Maybe it's, making the bed. You're doing some kind of motion or physical activity for a couple hours every hour. If you do 2 minutes every hour for 8 hours, that adds up to 16 minutes of exercise. You've met half of your minutes for that day if you're doing 30 minutes a week, 5 days a week. Okay, so that's one example. The other thing is if you have little or no access to transportation to get to a gym, then home exercise is going to be your best option. So you can do things like putting on music and dancing. You can find some really good exercise videos. Again, I would recommend working with a physical therapist to get a solid program for strengthening and aerobics that then you can conduct at home, and, safely. If you do have some transportation and you are able to explore gyms in your area where you can, where you have public transportation available, then I would recommend setting an appointment with that fitness center manager or personnel to take a tour of that gym. Just by taking a tour of that gym, you'll be able to tell, is this fitness center accessible for me? First of all, can I get in the door? Once I get in the door, is the rest of where the weight equipment is and where the machines are and the cardio equipment, is that accessible? Is there enough room for me to transfer between equipment? Do they have an arm ergometer that I can use to pedal? And a lot of times you can ask for a reduced rate if they don't have all the equipment that you need. You can ask if they have a personal trainer who's worked with people with disabilities, or if they have an inclusive fitness trainer. Also take note of how, when you look at this website of this fitness center, do they talk about any classes that they have that are inclusive? So you're doing a little research on your end and maybe sometimes you have to do a little advocacy on your end for yourself as well, in terms of cost, and not paying for something that you're not necessarily getting, but doing a little bit of research. And also realize too, YMCAs are prominent throughout the United States. They have scholarship programs as well. So you can fill out an application. I think they need your tax form, but you can apply for a scholarship for a YMCA to get access to that fitness center. I would recommend too conducting a search for adaptive sports in your area. There may be that you may be surprised. There may be some adaptive sports like adaptive kayaking, adaptive fishing. There's one organization in my local area that if you're a hunter and you like to hunt, they have an indoor like shooting range, and they have stands that are adapted for people who have disabilities. So there's a lot of things that it doesn't necessarily have to be sports. It might be recreation. So the other thing I'd recommend is checking out the National Park Service. I can get a link for that. They have an accessibility. They talk about their accessibility on their website. And so a national park oftentimes has pathways where you could go for a walk or a wheel, or, you know, in your power chair to get into a different environment. And if you like fishing, for example, you know, getting from your parking spot to where you're fishing, that's all part of physical activity. You might not be catching any fish, so you move to another area. So that's all part of your physical activity minutes as well. So everything counts. Also, I'd recommend looking into your local community pool and see if they have a lift. Sometimes the cost of a local community pool is a little bit less than if you're going to a fitness center. So that's all I have in terms of physical activity. I'll turn it back to Juanita. Thank you all.
Thank you, Doctors Tudor, Whelan, Polfuss, and Crytzer. Weight management and weight-related issues is one of the topics in the Spina Bifida Community-Centered Research Agenda. This series was planned to bring attention and information about the topic. You will receive the recording of the session and a copy of questions and a copy of the resources referenced. So thank you all for joining us tonight, and thank you again to the presenters.